Hi friends, welcome to Indian Healthcare BPO channel. Indian Healthcare BPO provide training for medical coding, medical billing and pharmacovigilance. For further detail, contact this number. I am Saranya Mohanakrishnan. So today I am going to talk about the physiology of endocrine gland, especially the organization of endocrine gland. Endocrine hormones. These are the chemical substances that produced by endocrine gland in response to certain stimuli and carried by blood to target tissue where they exert their physiological action. Endocrine glands, these glands that are secrete their hormones directly into the blood rather than through a duct. Example, growth hormone from anterior pituitary gland cause growth in all part of the body. Then anatomical location of endocrine gland. These are pineal glands, pituitary glands, and hypothalamus, and parathyroid and thyroid, thymus, pancreas, and adrenal gland, and ovaries in female, and placenta during the pregnancy in females, and testicles in male. Then hormones produced by endocrine gland. We'll first talk about the hypothalamic gland. Hypothalamic gland produce thyrotropin releasing hormones, corticotropin releasing hormones, growth hormone releasing hormones, and somatostatin and vasopressin. Then talking about the pituitary gland, it produces growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, and melanocyte stimulating hormones, and luteinizing hormones, and follicle stimulating hormones. Then thyroid gland, which produce T3 and T4, and parathyroid gland produce parathyroid hormone, and testicles in male produce testosterone, and ovaries in female produce estrogen and progesterone. Then the chemical structure and synthesis of hormones. There are three general classes of hormones exist. First, we'll talk about the protein and polypeptide. These hormones ranges from small peptide with few as 3 amino acid to protein with almost 200 amino acids. In general, polypeptide with 100 or more amino acids are called proteins, and this with fewer than 100 amino acids are called peptides. Steps for synthesis of protein and peptide hormones. First, synthesized as pre-pro hormone, which is biologically inactive, then cleaved to form smaller pro-hormones in endoplasmic reticulum, then transferred to Golgi apparatus for packaging into the secretory vesicles. Here, the enzymes in the vesicles cleaves the pro-hormone to produce smaller biologically active hormones and inactive fragments. These vesicles stored within the cytoplasm until their secretion is needed. Then the steroid hormones. These hormones are usually produced from cholesterol, and the structure is similar to cholesterol, and they are lipid soluble. They can simply diffuse across the cell membrane when synthesized and then enters the blood. The third type is amino acid, which are derived from the tyrosine and which is then converted to adrenaline and non-adrenaline. Then the classification of hormones based on chemical structures. First, we'll talk about the protein and polypeptide hormones, which are anterior and posterior pituitary hormones, and insulin, glucagon, and parathyroid. The steroid hormones are cortisol, aldosterone, estrogen, progesterone, and testosterone. And derivatives of amino acid tyrosines are thyroxine, triiodothyronine, and epinephrine and non-epinephrine. Then the mechanism of action of hormones in the receptor. The first step of hormone action is to bind specific receptor at the target cells. Cells that lack the receptor does not respond. When the hormones combines with its receptor, their action usually initiates as a cascade of reaction in the cells. There are various mechanisms of hormone receptor interaction. There are four: ion channel linked receptors, G protein linked hormone receptors, enzyme linked hormone receptors, and intracellular hormone receptors. First, we'll talk about the ion channel linked receptors, which is located at the cell membrane and directly activated by the ligands binding. This combination causes change in the structure of the receptors. Some of the ion channel receptors are closed and open channels for sodium, potassium, and calcium, and the response occurs in the millisecond. Then we'll talk about the G protein linked receptors. When the hormone activates the receptor, the inactive form of alpha, beta, gamma G protein complex associates within the receptor, it gets activated with exchange of GTP for GDP, and this cause alpha subunit dissociates from beta and gamma subunit of G protein, and which leads to cellular response. Next type is enzyme linked hormone receptors. Here the receptor or tyrosine kinase residue. When the signaling molecules binds the receptor, the receptor dimerase, and the tyrosine residues on the intracellular domain or get phosphorylated and triggering a downstream cellular response. Once the tyrosine residues got phosphorylated, it produced the cellular response. Then we'll talk about the intracellular hormone receptors. After the hormones binds the receptor in the cytoplasm or nucleus, the hormone receptor complex binds the hormone receptor element on the DNA. This either activates or inhibits gene transcription, formation of mRNA and protein synthesis. Then we'll talk about little bit about the hypothalamus and pituitary gland overview. Hypothalamus produce thyrotropin releasing hormones, gonadotropin releasing hormones, corticotropin releasing hormones, growth hormone releasing hormones, and prolactin inhibiting hormones. Talking about the pituitary gland position, it lies in the hypophyseal fossa of the bone, sphenoid bone, between the optic chiasmus and the mammillary body. The pituitary gland is divided into anterior lobe and posterior lobe. Anterior lobe, also called as adenohyphosis, true gland which secretes hormone. Posterior gland, also called as neurohypophysis and connected to hypothalamus through hypothalamo-hypophyseal tract, stores hormones secreted by hypothalamic nucleus. Also, the all secretion of pituitary is controlled by either hormonal or nerve signal. Anterior pituitary is controlled by hormones called hypothalamic releasing or inhibiting hormones, which is secreted from hypothalamus. Posterior pituitary controlled by nerve signal that originates from the hypothalamus. The anterior lobe of pituitary. Hormone releasing or inhibiting factors produced from the hypothalamus use the hypophyseal portal system of vesicles to reach their anterior lobe of the pituitary gland. The anterior pituitary connected to the hypothalamus also by hypothalamo anterior pituitary portal vesicles. The anterior pituitary produce six peptide hormones, prolactin, growth hormones, thyroid stimulating hormones, adrenocorticotropic hormones, and follicular stimulating hormones and luteinizing hormones. The anterior pituitary cells. There are five different types of cells which produce the hormones. First, the somatotropes, which produce growth hormones, corticotropes produce adenocorticotropin, thyrotropes produce thyroid stimulating hormones, gonadotropes produce luteinizing hormones, and also follicular stimulating hormones, and lactotropes produce prolactin. So, these are the hypothalamic hormones which stimulate anterior and posterior pituitary gland to produce their action on their target cells. Physiological functions of growth hormones. All the major anterior pituitary hormones except for growth hormone exert their action mainly by stimulating the target gland including thyroid gland, adrenal gland, ovaries and mammary gland. Growth hormone however does not function through the specific target gland but exerts its effect directly on all or almost all the body tissue. Growth hormone, also called as somatotrope hormones or somatotropin. These hormones promote increased size of cell and bone growth. Growth hormone has several metabolic effects. Aside causing growth, growth hormone has multiple metabolic effects including increased rate of protein synthesis in most cells of the body and increased mobilization of fatty acid in blood and increased use of fatty acid for energy, then decreased rate of glucose utilization through the body. Thus, in effect, growth hormone enhance body protein and decrease fat stores and conserve carbohydrates. Then growth hormone promote protein deposition in tissue, enhancement of amino acid transport through the cell membrane. So the increased concentration of amino acid cause increased production of protein synthesis. Then enhancement of RNA translation to cause protein synthesis when amino acid concentration is low in these cells. Increased nuclear transcription of DNA to form RNA which promotes more protein synthesis and growth. Decreased catabolism, which is the breakdown of protein and amino acids. Summary: growth hormone enhance amino acid uptake, protein synthesis by cells, while at the same time it reduces the breakdown of protein. Growth hormone also enhance fat utilization for energy. Growth hormone has specific effect in causing release of fatty acid from adipose tissue and therefore increase the concentration of fatty acid in body fluid. Growth hormone decrease carbohydrate utilization, decrease glucose uptake in tissue such as skeletal muscle and fat, and decrease glucose production by liver and increase insulin secretion. Then growth hormones stimulate cartilage and bone growth, increase deposition of protein by chondrocytes and osteogenic cells cause bone growth. Increased rate of reproduction of these osteogenic cells also cause bone growth. A specific effect of converting chondrocytes into osteogenic cells that cause deposition of new bones. Stimulate growth in long bone by growth in epiphyseal cartilage. Then the abnormalities of growth hormone. Gigantism, which develops in childhood. It is caused by growth hormone producing cells in the anterior pituitary gland or may because of tumors in the glands become excessively active. So with large quantities of growth hormone all body tissues grow rapidly. Clinical features are height increase up to 8 feet tall, large hands and feet and soft tissue grow rapidly and it also causes hyperglycemia. Then comes the acromegaly which develops in adulthood. Here, the person can't grow taller because the epiphyses of the long bone become fused with the shaft in the adults, but the bone become thicker and soft tissue can continue to grow. Clinical features of acromegaly are enlargement of membranous bone like cranium, nose, portion of vertebrae increases in size. Enlargement of soft tissue organs like tongue become enlarged, liver and kidney become greatly enlarged. This is the picture of acromegaly and gigantism. Okay, thank you guys. For more videos, subscribe the Indian Healthcare BPO channel.